Hello everyone, welcome back to the channel. Imagine this, you worked on a claim, everything looked correct. The claim was submitted successfully, but a few weeks later, instead of getting paid, the insurance company denied the claim because the patient was not active on the date of service. Or maybe the insurance company gives you another denial reason, such as the patient is not eligible, coverage terminated, service not covered, benefit maximum reached, authorization required, member not active on the date of service. At this point, you may start asking yourself, what went wrong? Did the provider make a mistake? Did the insurance company make a mistake? Or did the patient lose their insurance coverage? These are called eligibility and benefits denials. But the good news is that many of these denials can be corrected if you know exactly what to check. In this lecture, I will teach you what eligibility and benefits denials are and why they happen. The most common eligibility and benefits denial reasons and what each denial actually means. How to identify the real root cause of the denial instead of making assumptions. How to verify a patient's insurance eligibility and benefits correctly. Which eligibility details you must always check before working on a denial. How to resolve each type of eligibility and benefits denial with practical, real-world examples. When you should correct and resubmit the claim, appeal the denial, or bill the patient. The documents and information you should always verify before taking any action. Common mistakes that cause eligibility and benefits denials and how to avoid them. Let's begin. What is an eligibility and benefits denial? An eligibility and benefits denial happens when the insurance company says, according to our records, this patient was not eligible for this service or the service is not covered under the patient's health plan. It simply means the insurance company is saying we cannot pay this claim because the patient's insurance coverage or benefits do not allow payment. It may be because the patient was not eligible on the date of service. The patient's insurance coverage had terminated before the date of service. The service is not covered under the patient's health plan. The patient has exhausted the benefit maximum for that service. The service requires prior authorization, but no authorization was obtained. The provider is out of network and the patient's plan does not cover out-of-network services. The claim was billed to the wrong insurance payer or the wrong insurance plan. The patient has other primary insurance and the claim was not submitted in the correct coordination of benefits (COB) order. The patient's coverage changed, but the provider's records were not updated before the claim was submitted. In simple words, the insurance company is saying, based on the patient's insurance plan and coverage on the date of service, this claim does not qualify for payment unless the issue is corrected or additional information shows that the claim should be paid. Let's understand this with a real-life scenario. Suppose a patient visits the clinic on July 10, 2026 for surgery. The provider performs the surgery. After the procedure is completed, the provider submits the claim to the insurance company for payment. A few days later, instead of receiving payment, the provider receives a denial from the insurance company. The denial reason says, member inactive on the date of service. Now, your job starts from here. You have to verify the denial reason. Find the real root cause of the denial. And based on your findings, you should take the appropriate action to resolve that denial. Always remember, verify the denial first and never guess anything. Never assume that the insurance company is right and never assume that the provider made a mistake. Let the facts guide your decision. Once you identify the actual root cause, choosing the correct next step becomes much easier. There are 8 steps to identify the real root cause of the denial. Step 1. Read the denial carefully. Step 2. Verify the date of service. Step 3. Check the patient's insurance information. Step 4. Verify eligibility again. Step 5. Check the patient's benefits. Step 6. Check for prior authorization or referral requirements. Step 7. Verify timely filing limits. Step 8. call the insurance company if additional clarification or confirmation is needed. Step 9. Decide the correct action. In this step, you must read the denial reason carefully. Before you start working on any denial, open the explanation of benefits (EOB) or electronic remittance advice (ERA). First, verify that you're looking at the correct claim by checking patient name, patient ID, claim number, date of service, DOS, provider name, insurance company. If these details don't match your claim, stop right there and find the correct EOB before moving forward. Once you've confirmed you're reviewing the correct claim, carefully review each service line. Check the CPT or HCPCS code, date of service, charge, amount allowed, amount paid, amount, patient responsibility adjustment, amount, denial codes, remark codes. If a CPT or HCPCS code has a paid amount of $0, it usually means that the service was denied. Also, determine whether the insurance company denied the entire claim or only a specific CPT or HCPCS code. Next, read the denial reason carefully, along with the denial code, remark code, and their descriptions to understand exactly why the insurance company did not pay. Then, calculate how much was paid and how much was denied for the affected CPT or HCPCS code. Always remember, never assume the denial reason is correct. Your first responsibility is to identify which CPT or HCPCS code was denied, how much was denied, and why it was denied. Once you have verified these facts, you can confidently move to the next step and investigate the real root cause of the denial. Now, in step 2, compare the patient's date of service with the insurance coverage dates. Then verify whether the patient's insurance policy was active on that exact date. Ask yourself, was the insurance policy active on the date of service? Was the policy effective before the patient received treatment? Had the policy already terminated on that date? Was the patient covered under the correct insurance plan on that day? Many denials happen because the biller checks the patient's current insurance status instead of checking the insurance status on the actual date of service. Remember, insurance companies always process claims based on the coverage that was active on the day the patient received treatment, not on the patient's current insurance information. For example, if the patient received treatment on March 10th but the insurance became active on March 15th, the claim will most likely be denied because the patient was not covered on the date of service. Likewise, if the patient's insurance ended before the date of service, the claim can also be denied. If the insurance was active on the date of service, you can confidently move to the next step. If it was not active, don't stop there. Find out why the policy was inactive. Verify the effective and termination dates, review the patient's registration records, and confirm whether the correct insurance information was collected at the time of service. Check whether the patient had another active insurance plan on the date of service or whether updated insurance information was missed during registration. If you discover another active insurance policy for that date of service, submit the claim to the correct payer after completing any required corrections. If there was no active insurance coverage on the date of service, document your findings, follow your organization's billing policy, and determine whether the balance should be transferred to the patient or handled according to your provider's financial policies. Now, in step 4, perform a fresh eligibility verification to confirm whether the patient's insurance coverage was active and valid on the date of service. Before taking any further action, never rely only on a previous eligibility check or old information available in the patient's account. Insurance information can change, and an earlier eligibility response may no longer be accurate. Always verify the patient's eligibility using available sources, such as insurance company or payer portal, clearinghouse eligibility tool, direct call to the insurance company. During the verification, carefully confirm: is the patient's insurance active? Was the insurance active on the date of service? What is the effective date of the policy? What is the termination date if applicable? Is this the correct insurance plan? Is the patient still enrolled under this plan? Are there any coverage limitations or restrictions? Pay special attention to the effective date and termination date because these details determine whether the insurance company was responsible for covering the patient's services on the date of treatment. For example, if the payer portal shows that the patient's insurance was active on the date of service, but the claim was denied as patient not eligible or coverage terminated, this could indicate an error that requires further investigation. If the patient is confirmed as active and eligible, save the eligibility verification response. Document the verification date and time. Record the representative's name or reference number if you verified eligibility through a phone call. Store the verification details according to your organization's workflow. Remember, proper documentation is your strongest support when you contact the insurance company or submit an appeal. It proves that the patient had active coverage when the services were provided. Now, in step 5, check the patient's benefits and confirm whether the specific service provided to the patient is actually covered under their insurance plan or not. But remember, just because a patient has active insurance does not always mean the insurance company will pay for every service. This is one of the most common mistakes in medical billing. Many beginners see that the insurance is active and they assume the claim should be paid. But in reality, payment depends on the patient's specific plan benefits, the type of service provided, and the requirements set by the insurance company. So before moving forward, carefully verify. Is this procedure covered under the patient's insurance plan? Does this service require prior authorization? Does the patient need a referral from their primary care physician? Is there any waiting period before this benefit becomes available? Has the patient reached the annual visit limit? Has the patient used the maximum benefit allowed under the plan? Is this service excluded from the patient's coverage? For example, a patient may have active insurance, but their plan may cover only 20 physical therapy visits per year. If the patient has already used all 20 visits, the insurance company may deny the next claim because the benefit limit has been reached. Another example, a patient may have coverage for a procedure, but if the procedure required prior authorization and the authorization was not obtained, the insurance company may deny the claim. This is why you should never stop your investigation after confirming eligibility. Eligibility tells you that the patient has insurance. Benefits tell you whether the insurance plan will actually pay for that specific service. So always remember, every insurance plan is different. Two patients may have the same insurance company, but completely different benefits, coverage limitations, and requirements. As an AR caller or denial specialist, your responsibility is to look beyond active insurance status and understand the patient's actual coverage. Take the time to verify benefits correctly because one missed detail can lead to a denial, delayed payment, and unnecessary follow-up work. When you verify benefits properly, you are not just resolving a denial, you are protecting the provider's revenue and increasing the chances of successful claim payment. Now, in step 6, check whether the service required prior authorization or a referral before the patient received treatment. This step is extremely important because many claims get denied even when the patient's insurance was active. Why does this happen? Because some procedures, treatments, and services require approval from the insurance company before the provider can perform them. This approval is called prior authorization. If prior authorization was required, but the provider did not obtain it before providing the service, the insurance company may deny the claim. So before moving forward, carefully verify. Was prior authorization required for this service? Was the authorization requested and approved before the date of service? Was the authorization number received? Was the authorization valid on the exact date of service? Did the authorization cover the same procedure that was billed? Was the approved service performed by the correct provider or facility? Was a referral required from the patient's primary care provider? Was the referral obtained and active on the date of service? For example, a provider may perform an MRI for a patient who has active insurance coverage. However, if the patient's plan required prior authorization and the provider did not obtain approval before performing the MRI, the insurance company may deny the claim with the reasons such as authorization required or no prior authorization on file. But remember, even when authorization exists, the claim can still be denied if the authorization details do not match the claim. For example, the insurance company may approve one CPT code, but the provider bills a different CPT code. In this situation, the insurance company may still deny the claim because the billed service does not match the approved service. Always remember, prior authorization is not just a formality. It is a payment requirement set by the insurance company. As an AR caller or denial specialist, your responsibility is to verify the complete authorization details, identify the exact issue, and determine the correct next action, whether the claim needs correction, reconsideration, or an appeal. When you check authorization carefully, you are not just reviewing paperwork. You are finding the real reason behind the denial and helping the provider receive the payment they rightfully earned. If anything is still unclear after your investigation, call the payer and get clarification. Remember, a successful payer call is not about just asking questions. It is about asking the right questions and collecting accurate information. Stay calm, be professional, and clearly explain your concern. For example, you can ask, "Can you please confirm why this claim was denied? Was the patient eligible on the date of service? Is this procedure covered under the patient's benefit plan? Was prior authorization required for this service? Can this claim be reconsidered if we submit the corrected information?" During every call, take detailed notes because these details can become important evidence later. Always document representative's name, call reference number, date and time of the call, information provided by the payer, next steps or required action. Remember, good documentation protects you, supports your decision making, and helps your organization resolve denials faster. A well documented call can make the difference between a denied claim staying unpaid and a claim successfully getting reconsidered and paid. Now you have all the information you need. You verified the patient's eligibility. You checked the denial reason. You reviewed the claim. You spoke to the payer if additional clarification was needed. Now it's time to fix the problem. Let's understand each situation step by step. If the insurance information was entered incorrectly and you identify the incorrect information, in this case, you just need to update the correct information or correct the claim with the updated information, and then resubmit the claim according to the payer's guidelines. Before resubmitting, always double check the corrected information. If the patient had active coverage but the payer denied the claim incorrectly, once you find that the patient's plan is active on the date of service and eligible for the treatment and the benefits were available, and you submitted the claim correctly and you still receive the denial. In this situation, you can challenge the denial, but you need documents or proof that support your position, such as eligibility verification proof, benefit verification details, claim information, EOB or ERA, medical records if required, authorization details if applicable, any payer communication notes. Once you collect all proofs or documents, you have to prepare an appeal letter and attach all the supporting documents to submit an appeal within the payer's allowed time frame. But you must remember, an appeal is not just a complaint. It is your opportunity to show evidence and explain why the claim should be paid. If another insurance should have been billed first. Sometimes the claim is denied because it was sent to the wrong insurance company first. This usually happens when the coordination of benefits (COB) information is incorrect or outdated. In this situation, carefully verify which insurance is the primary payer, which insurance is the secondary payer. Was the claim submitted to the correct payer first? If you find that the COB information is incorrect, update the patient's insurance order. Correct the claim information. Submit the claim to the correct primary payer first. Once the primary insurance processes the claim, submit the remaining balance to the secondary insurance if applicable. Always remember, the primary insurance must process the claim before the secondary insurance can consider payment. Sending the claim to the wrong payer or billing the secondary insurance first can lead to unnecessary denials and payment delays. Take a few extra minutes to verify the payer order. It can save hours of follow-up work and help the provider receive payment much faster. If prior authorization was required but not obtained. If you find that the service required prior authorization but it was not obtained before the service was performed, first determine why the authorization was missed. Then check your internal records to confirm whether an authorization request was submitted, approved, denied, or never requested. If the authorization was approved but not included on the claim, correct the claim by adding the authorization number and resubmit it according to the payer's guidelines. If prior authorization was required but was never obtained, check whether the payer allows a retroactive authorization request. If retroactive authorization is allowed, submit the required documents and request the authorization according to the payer's guidelines. If the retroactive authorization is approved, correct the claim with the authorization details and resubmit the claim. If the payer does not allow retroactive authorization or the request is denied, the claim may remain denied unless the payer's policy allows an appeal. If you believe the denial was incorrect, collect supporting documents such as eligibility verification, authorization request records, if any, medical records, physician's order or referral, if applicable, any communication with the payer. Then, prepare an appeal letter and attach all supporting documents within the payer's allowed appeal time frame. If prior authorization exists but was missing from the claim, verify. Was authorization actually approved? Was it valid on the date of service? Does the authorization cover the billed CPT or HCPCS code? Was the correct provider or facility listed? If everything matches, add the correct authorization number to the claim. Correct any missing authorization information. Resubmit the claim if the payer allows corrected claims. Before resubmitting, confirm the payer's specific requirements. Some payers allow corrected claims, while others require a reconsideration request or appeal. Never assume every payer follows the same process. If the service is truly not covered under the patient's plan. Sometimes, after completing your investigation, you may find that the service is genuinely not covered under the patient's insurance plan. So, before making any decision, verify. Is the service excluded from the patient's benefit plan? Did the payer confirm that the service is not covered? Did you verify the patient's benefits and coverage details? Is there any exception, medical necessity policy, or special coverage that applies? If you confirm that the service is truly not covered, document your findings clearly. Review the providers and payers' billing policies. Determine what to do with the remaining balance. Check whether you should bill the patient, submit the balance to the secondary insurance if the patient has one, or write off the balance. Always make your decision according to the patient's benefits, the insurance company's guidelines, the provider's contract, and your organization's billing policies. If the denial cannot be resolved, document everything, such as what was reviewed, who was contacted, what information was received, why the denial could not be resolved, what final action was taken. Proper documentation helps maintain accurate records, supports future follow up, reduces repeated mistakes, and creates a smoother healthcare billing process for everyone involved. In conclusion, let me leave you with one simple rule. Whenever you receive an eligibility or benefits denial, do not panic and do not guess. Just follow this simple checklist. Read the denial carefully. Verify the date of service. Check all patient insurance details. Verify the patient's eligibility. Review the patient's benefits and coverage. Check prior authorization or referral requirements. Contact the insurance company if needed. Document every finding. Correct, appeal, or resubmit the claim based on verified facts. Always follow the payer's guidelines and your organization's policies. If you follow these steps every time, you will identify the real reason for the denial, take the correct action, reduce claim errors, improve first pass claim acceptance, and help your organization receive payment faster. Thank you so much for watching this video. I hope this lesson helped you understand eligibility and benefits denials in a simple and practical way. If you found this video helpful, please like, share, and subscribe to the channel. It really motivates me to create more free, high-quality medical billing training for you. If you have any questions or if there is any medical billing topic you want me to explain next, let me know in the comments. I read your comments and use your suggestions to create future lessons. Thank you once again for your time and support. Keep learning, keep growing, and I'll see you in the next video.